Time to look at some of the things happening in the world of politics, and we do that with our Professor of Politics, Dr. Jim Jost from the University of Newcastle, who is a bit frustrated today. Jim, you've bought yourself a new phone, and now you'll go through the process of having to reset everything in the new phone. That's a bugger of a thing to have to do.
Yeah, it's a challenge, mate. But
half of your stuff didn't come across. You'll be spending the next 6 months on that, right?
Yes.
All right. A challenge even bigger than Jim's phone today is tackling the aged care situation at a Commonwealth level. Jim, we've had the Royal Commission just happen very recently into that. A couple of things you want to point out from that very process today.
Well, yes, Mark. I mean, it's a major report from the Royal Commission into aged care, and we saw when that was being conducted and coming out that there were all sorts of problems, some really serious issues and real problems in the way in which aged care was delivered. Now, it's complicated by the fact that the Commonwealth is responsible for a range of issues, including the regulatory framework under which aged care is delivered, but the states are also involved in this because much of the delivery occurs at the state level through state facilities. So there's that sort of federal state dimension. But what's, I think, really interesting about this Royal Commission is the philosophy that is embedded in the recommendations that the Royal Commissioner articulated quite strongly through a number of recommendations. But the core, Mark, the core of that philosophy is around a rights-based approach. That is to say, the human rights of aged people, of old people, that when they put themselves into care facilities of whatever description, whatever particulars that they might be, that they have rights and are entitled to certain standards of care, certain levels of medical support, a whole range of issues. And one of the recommendations of the Royal Commissioner was to educate caregivers and administrators and bureaucrats in the need to understand those rights and to implement those rights. That stands in stark contrast to a history of government approaches and, not wishing to single out the current government, but if we go back over 10, 12 years, there's been a history of not a rights-based approach, but in fact, if we go back to the beginning of Federation, the approach has been on, some might call it cost-cutting, but others, I think we could just simply say on a rationing out process. So saying there's a limited amount of money and we're going to determine who's deserving of that support, and some people aren't, and so they're going to be excluded, or they have to fend for themselves in one way or another. This is often dressed up, Mark, in sort of, people should be making provisions for themselves. The fact remains, and I'm sorry, this sounds a bit like a soapbox, but the fact remains, people who make provisions for themselves are just as likely to end up in a terrible situation as those who don't make provision. And what I mean by that is that they make provision, but they have no control over what goes into the care, over what the care deliverers do, and so their rights, if you like, are totally irrelevant in that old model. The challenge for the government is picking up on the Royal Commission's philosophy and implementing it when the current government and governments before them, including Labor governments, have been built around a cost-cutting, a money-saving device. We can only afford so much. Well, we've seen, Mark, in the past 12 months that when we need to roll out money to save lives and to make life much more amenable for people in a pandemic, the government finds the money.
So here's the thing. If we go back a little bit there, Jim, to a very much a philosophical question, which is a fairly simple one to answer. Yes, there should be, when you talk about a rights-based situation, there should be at a base level things that we are all entitled to when we become seniors and when we become needing of aged care. Why is it, do you think, that entire sector, that entire message is continually lost? And it really doesn't seem to matter which team of politics is in. It just seems to be forgotten. And it's a large section of Australians, and it's something that concerns all of us, because if we're lucky enough, we will all be in the situation one day, if we reach that level, that we need to ask those questions for ourselves or have our family ask for us, but yet it just seems to be lost in the deck of cards somewhere continually.
Yes, well, we're talking about 8 million people at least in the current demographic.
8 out of 24 is a pretty decent slice.
It's about a third. So, government has a responsibility here. There are all sorts of good economic arguments besides the big picture one and the rights-based approach. Investing in the aged care sector, and I think the government's let slip, or someone's got the scoop, or whatever it happens to be, that in the forthcoming budget, the government's planning to declare $10 billion over the next 4 years to pump money into the system. That's one dimension. But if you consider that the aged care sector has been underfunded by at least $10 billion over the past few years, that even if the government puts in $2.5 billion a year for 4 years, in 4 years' time, they will only be where they were 10 years ago. No improvement whatsoever.
Factoring for inflation, possibly worse than that.
Yes.
Potentially.
And if the government sort of invests in the aged care sector, there's all these other dimensions, like there's going to be a huge need for aged care workers, properly trained and all the rest. So I saw some figures yesterday that said it was of the order of about 70,000 in the first instance. So there's 70,000 people in new jobs. Then there's the training facilities that will be needed. So TAFEs around the country, university nursing facilities around the country, all will be able to contribute and get some benefit from the training program. So there are a number of economic spin-offs. The real question mark is whether the current government is capable of putting aside its small government mentality to focus on what's going to be in the long-term interests of Australia over the next 15 to 20 years.
All right, super quick, Jim, before we let you go and get back to your telephone there. Essentially, this is a health issue, and do you think this is where we have problems with these types of issues, where we have the federal government taking action of a certain proportion of it, and then the state governments have got their bit to do, so everything's always out of whack because you just don't have one body looking after everything?
The short answer to that is the Commonwealth is responsible for the regulatory framework under which the states operate and under which the deliverers of aged care operate. If the Commonwealth is able and willing to ensure a proper regulatory framework, then a lot of those other issues are resolved within the regulatory framework. And I know that the government's response to that is, well, too much regulation, too much red tape, it gets in the way and people can't deliver. Well, thus far, with minimal regulation and poor government regulation, we've had disasters in the aged care sector. That is simply a matter of fact, as the Royal Commission established with all the evidence it heard. So it's up to the government to actually sort of take stock and think about what's in the best interest of Australians as a whole, rather than what's in the best interest of the bureaucrats' bottom line and balancing so-called fictional budgets.
What an idea. What a novel idea. All right, Professor of Politics, Dr. Jim Jost, as always, thank you for your time, mate. I'll leave it with you.
My pleasure, Mark.
2NURFM, a broadcast service of the University of Newcastle.